Hi, Tom DiEnna from Doylestown Emergency Associates. I've been here as a part of the emergency department with Doylestown Health for a little over 6 years now. Been a long-time resident of Bucks County, still live in Bucks County, but grew up here, went to high school in Bucks County. All my family and friends are here and local. I have three boys, but so my time is really spent with them when I'm not here at the hospital. I like coaching youth sports, I like being part of their youth, which has been great. We also like to travel together as a family, get experiences outside of school and work. Also like exercising and spending time with family and friends. So I guess there's a few reasons why I chose to work in the emergency department. Going through medical school, I had a lot of interest really in a lot of different fields of medicine. And for a little while, I wanted to be a cardiologist, I wanted to be a surgeon, I wanted to be a trauma surgeon, an orthopedic surgeon. And I started to figure out though that in those fields, what I really liked was the acute care, and the emergency aspects of those fields. So kind of started to work toward emergency medicine. And over time, what I learned is there are a lot of other reasons why I like emergency medicine. I think first and foremost, I feel like the emergency department is the doorstep of our community. I get to meet people from all different walks of life, and I get to take care of people that I never would have met in normal life. And I realized that really I have a connection with everybody, and it's nice to be here and our team to be available when some of those people are in need and are vulnerable. So the other thing I've learned is over time that care for any one patient is really a team effort, and there's really, in my opinion, no better place to work on patients as a team than the emergency department. So I think there's some other reasons. Certainly, I take a lot of pride in what we do, and more importantly, when we are able to help people, that's really the best part of my job. So they're just some of the few reasons why I like emergency medicine and what got me into it. We often get asked what's the hardest part of our job, and there's no question the hardest part of our job is delivering bad news. We fully appreciate that people show up to our place of work and oftentimes their most vulnerable state or on days they never expected to be here. Delivering bad news is never easy. It's never the same. It's always hard, and it's just as hard as it would be for everybody else. Over time, our team, I think, has come to learn how to deliver it in the most empathetic way we can. But it's certainly not easy, especially when people aren't expecting bad news. Conversely, one of the best parts of our job is delivering good news, and easing a fear that somebody may have came to the emergency department with. So if we're able to ease a fear, it's really counterbalanced by those tough days. But that's part of emergency medicine and what we're good at. We're really lucky here at Doylestown Health. Really, it's an impressive place for a community hospital. I mean, we offer medical care that's probably only rivaled by some of the largest institutions around the country. That's my personal opinion. But really, probably what's more important is that decisions here, aren't made for any other reason than putting the patient first. And, over my years working here, it's been so obvious. And what's really brought it to light, I think, is the care that we've been able to provide during this pandemic. The teamwork, the decisions that were made were, no question, putting the community first, the patient first. And that really just drives all the other decisions. So it really makes it an easy place to work for me, because that's clearly what we do here in the emergency department. And when I see my colleagues, both in the emergency department and the rest of the hospital, feel the same way and treat our patients the same way, it just makes work much easier. So it's really been a great place to work. It's a great asset for our community.